Diabetes is an extremely serious problem in Barbados, so much so that we've taken on the name the amputation capital of the world. At this point, it has become a household disease, with almost every Barbadian family having a member with diabetes, including my own. My grandmother has been living with diabetes for years, and though she has it better than some, what she's gone through, I wouldn't wish on anyone. How did you feel when you were first diagnosed?
I saw death. As a child, that is what was associated with diabetes. You just suffer and you die. I was just crying silent tears with so much regret that I had lived my life so carelessly. The times when I chose not to eat because I had to work, I had to get this client out, I will go in another hour.
And living with diabetes is definitely not easy, so I wanted my grandmother's perspective on how it's changed her daily life.
For me, it was just becoming disciplined in what I eat, exercise, and regular checks of my blood sugar.
And if there was one thing that you could change about how we handle diabetes in Barbados, what would that be?
I know a lot of people wait for a diagnosis. They have family who are diabetic. And I would hear people talking about bad diabetics. And these people are waiting and hoping it wouldn't happen to them, but they have not changed anything. They have not looked and to figure out, okay, what do I do to ensure that I feed my body well? You have to appreciate that the doctor will do his job, but you as an individual have to do yours.
Her case is not uncommon, however. Countless Barbadians have been diagnosed with diabetes, with many leading to outcomes such as kidney disease, heart disease, blindness, stroke, and even amputation. The issue is that we often don't understand how serious diabetes really is until it looks us straight in the eye. So I spoke with the president of the Diabetes and Hypertension Association to understand exactly what diabetes is and the scope of our crisis.
Diabetes is more or less when the body does have a lot of sugar knocking around. Your sugar is not properly being broken down, and therefore it impacts your nerve system in many ways.
Barbados has been called the amputation capital of the world. So what does this mean, and how exactly did we get to this point?
And what it means is that too many amputations are taking place. That perhaps there's not enough treatment to avoid amputation. And of course, amputations are a logical outcome from diabetes. If, for example, you have a grandmother, a grandfather, if you have someone who has had some impact with the circulation, the fear was that that person will lose that limb. People were going to the hospital. You might have heard about someone who went in there just casually checking on some things and then lost a toe, lost a foot.
Do you think the average Barbadian really understands how serious diabetes is?
It is this idea that that's for old people. Let me live my life normal and do the normal things that give people a false sense of security. You know, I can bring a cow or a horse to the water, but I can't exactly make it drink. And that's where the lifestyle choices come in. I met her at the hospital too late. Diabetes is to a level where there's not much anybody can do other than to try to treat you. Or I can put you on some medication and say, listen, you're not too bad. Careful, let's ease off of that. Drink less of that. Walk more. But then when you leave the doctor's room, it's like, I go back to my lifestyle.
The general consensus seems to be that Barbadians are too relaxed when it comes to diabetes and don't take enough initiative in prioritizing their health. So I went into Bridgetown and into communities just like this to figure out how Bajans really look at diabetes.
Diabetes is a serious issue in Barbados and across the world because like a lot of people actually suffer from diabetes. A lot of young and old people too. So yeah, I think that it's actually a disease that a lot of people fighting with.
I am of the opinion that persons appear not to be taking it too seriously in terms of their diet, etc.
It is even more prevalent in the younger generation now. One thing you used to hear about the older people having it, but now it's all over the place.
It's very serious, seeing that so many people are having amputations of their limbs. And when people have amputation of limbs, then they can't work as effectively as they would. So then the economy would be at a lower level.
Wherever you go, whether it's family, friends, there always some person or persons there that has that disease, which means it's very common, and that is really a concern, and it should be for everybody. You know, it's a very dangerous disease, and you have to really make sure you manage it properly.
I think persons are taking diabetes serious. They take the medication, they try to eat the right foods, and sometimes some person you'll find will be walking and drinking the necessary amount of water.
While it appears that Barbadians are viewing diabetes seriously, the numbers don't lie. This is particularly saddening because diabetes can be avoided and managed by doing simple things like getting adequate rest, exercising, and having a balanced diet. This is a fight that we can win, but only if we act now. For the sake of our families, our future, and ourselves, let's not wait for another amputation to start caring. Take initiative, take charge, take care of your body.